Hey guys, today we're going to be talking about whether marijuana can be medicinal. We're going to talk about the ethics behind it, also addiction versus treatment, and the health risks that go along with it. So, first of all, medical use is absolutely not the same thing as recreational use. There is a different chemical that affects a different part of the brain. So, it is not the same as, the stigma that goes along with marijuana use. It is a different chemical that's extracted from the plant, and it does not cause the same effects as regular marijuana that is used for recreational use. Some states have actually legalized the use of medical marijuana, but federally it is still illegal. So it's not a treatment option that's available, in every state. It is efficient in the use of various problems. It can treat so many different things, especially the use of medical marijuana in neurological patients, things like Parkinson's disease, Alzheimer's, especially epilepsy, kids who have seizures. It has worked wonders for us, studies have shown. As far as treatment versus addiction, studies that I looked up from an online library with Wiley, it stated that seizure activity can be dramatically reduced. There was a study of a 5-year-old patient named Charlotte. She was started on a low-dose sublingual plant extract, and she went from having like 3 to 4 seizures a day to having absolutely no seizures for 7 days straight. So it dramatically reduced that. She was actually on a pill that was supposed to be reducing her seizures, prescription medication. It was not helping her. So her mother decided to try her on this seizure-free for 7 days. So it was a big turnaround from what she had been experiencing with prescription medication. CBD is what is used medically. It acts on a different area of the brain, thus not causing what we would consider a high feeling that is associated with the stigma of marijuana use. You do not get the same high feeling because the feeling of being high actually comes from the chemical THC that is in the plant. So it's extracted differently, so it is not the same type of thing. Another thing that is really great about the use of medical marijuana is not only that you can treat neurological patients as far as your Alzheimer's and the things that we discussed prior, but it can also treat nausea in cancer patients, people that are receiving chemo or strong doses of medication that makes them sick. This can actually help them with nausea when other medications cannot. It actually is known to increase hunger in AIDS patients, so they're able to gain weight and keep a steady weight on them instead of losing weight, which is the alternative. And the great thing about medical marijuana is that patients are actually able to wean themselves off addictive prescription medication that, there's always another thing that can come from taking a medication. So they're actually able to wean themselves off oral prescription medications, and this is a more natural alternative for them to have, as a backup if this doesn't work. The health risks that go along with it, everything that you take, whether it's prescription or natural, it does have health risks with it. The FDA does not approve this medication, like we talked about. It's not, federally legal. It's not available everywhere. So the FDA has not approved this for use. Also, according to the CDC, I was reading on there, it does say that people do tend to smoke this as a way of ingesting it. And that can always cause respiratory problems, cardiovascular issues. So that is a risk if that is the way that you're intaking it. But as far as this goes, my information that I'm trying to give you guys, we're going to go more for the CBD, which is usually in an oil form. You can go sublingually, things like that. And also another risk that is associated with this is it is very hard to tell how much of the plant extract or chemical you're actually getting when you do this, because every plant is different and every plant has a different strength. So it is hard to know exactly how much you are getting out of this. So it's hard to kind of adjust it for each patient. But it is a really great option that's out there for people who need it. If it's able to reduce seizure activity in kids that can't, have help any other way, that they've been on prescription medications and it just does not seem to help. Like I said, studies have shown that cancer patients, these horrible chemo drugs that they're ingesting are making them so sick that sometimes that is harder for them to heal, because you're not giving yourself enough protein, you're not giving yourself enough nutrient, so it's hard for you to heal and get your energy back. So this is dramatically helping those type of patients. And I have actually seen it myself work on a close friend of our family. She has had Parkinson's, and she was uncontrollably shaking and not able to really function without help. She started on CBD oil, and it has completely changed her life. She's able to function. She's able to live alone. She can dress herself, feed herself, do everything that she was doing prior. So that has been a wonderful help. So I think it's a great option for people that need it. Some people don't like the thought of it. They think it's unethical to use this product because of the stigma that goes along with it. And I think that we kind of need, as a society, to kind of open our eyes and see that, it is useful, not necessarily to be recreational use, but it can be useful to these patients who really need it and have no other option. So that is the end of my speech. Thank you guys.